Okay, this is section 2, anxiety and somatoform disorders. What is a phobia? Anxiety involves increased heart rate, rapid breathing, sweating, a dry mouth, and a sense of dread. When it becomes so intense and long-lasting that it disrupts daily life, it is called an anxiety disorder. And there's different types of anxiety disorders. A phobia is a strong, irrational fear of an object or situation that is not likely to be dangerous. The phobic usually realizes the fear goes beyond what makes sense. And there are 3 specific kinds. There are specific phobias, social phobias, and agoraphobia. Specific phobias involve fear of specific situations or things. Social phobias involve chronic anxiety over others' negative evaluations or acting in a way that is embarrassing or humiliating. Generalized social phobia is a more severe form in which fear occurs in nearly all social situations. An agoraphobia is a strong fear of being separated from a safe place, like your home, or a person, like your spouse, or of being in situations such as crowds that are difficult to leave. Our next types of anxiety disorders are generalized anxiety disorder, sometimes called free-floating anxiety, and it's characterized by strong and long-lasting anxiety that is not focused on any particular object or situation. And then we have a panic disorder, which consists of recurrent panic attacks or unpredictable attacks of heart palpitations, dizziness, chest pain, sweating, faintness, and a feeling of impending doom, and constant worry about having panic attacks, which leads to restricting activities and impaired functioning. This sometimes leads to agoraphobia. And then finally, there's obsessive compulsive disorder, or OCD. This consists of persistent, often upsetting thoughts or obsessions that may produce strong urges to perform repetitive, ritualistic behaviors, which are compulsions, to try to get rid of the thoughts. The obsessions and compulsions, though often recognized as irrational, are constant intrusions and can severely impair daily activities. What are the causes of anxiety disorders? First, the biological factors. Some people appear to have inherited predispositions to develop anxiety disorders. The effort to identify the specific genes or gene combinations involved in anxiety disorders is difficult because the mere presence of a gene doesn't necessarily predict the appearance of a disorder. Genes are often switched on or switched off by environmental triggers. Abnormalities in the brain's neurotransmitter system underlie some anxiety disorders. Some other factors you can have are psychological or environmental. Environmental stressors and psychological factors, especially cognitive processes and learning, are also involved in most anxiety disorders. Anxiety disorder sufferers may exaggerate dangers of certain stimuli and underestimate their own ability to deal with threatening events. So now we'll take a look at somatoform disorders. And our leading question is, can a mental disorder cause blindness? Somatoform disorders involve symptoms of a somatic or bodily disorder, even though there is nothing physically wrong. There are psychological disorders that take physical form. And we'll take a look at a couple. We have conversion disorder, hypochondriasis, somatization disorder, somatoform pain disorder, and body dysmorphic disorder. And our first one, conversion disorder. In conversion disorder, once called hysteria, one appears to be, but is not, blind, deaf, paralyzed, or insensitive to pain in parts of the body. The often physiological impossible symptoms appear to be an unconscious avoidance tactic brought about by severe stress. And I have a quick video for you on conversion disorder.
Anderson Cooper 360, CNN, weeknights at 8 and 10 Eastern.
It's very
heartbreaking to me, to be honest. Knowing that right now I can't do what I love.
Farrah Sanchez was a cheerleader, an honor roll student, and as a senior at Leroy Junior High School in upstate New York, well on her way to planning her college future. When she woke up from a nap last October, everything changed.
I couldn't stop stuttering.
The stuttering took over, really contorting on the left side of, with her mouth and her neck.
The doctors told Farrah her condition was brought on by stress and she would get better. But once the stuttering ended, it soon gave way to uncontrollable twitching. And this goes on all day long, Farrah?
Yes. Yeah.
All day long?
All day long.
This video was taken in the hospital in mid-October by Farrah's mother, soon after she brought her daughter in for twitching. It was on that day, she says, a nurse told her Farrah wasn't the only one who had been brought to the hospital with the condition.
She had said, not to alarm you, but somebody needs to contact somebody because you're the fourth girl in a week that come in with this.
In all, health officials say 12 girls from Leroy Junior-Senior High School have exhibited similar symptoms. The girls were from different grades, and some didn't know each other, but many did, including Farrah's friend, Lydia Parker.
Last time I went to the neurologist, they said that they're not sure and that they'll keep looking into it. But besides that, they haven't told anyone anything.
Hundreds of parents met with health officials who said tests showed no evidence of any environmental factors at the school. More tests ruled out infection or communicable diseases. So what is going on? A doctor who has evaluated 11 of the 12 girls says it's conversion disorder.
What happens is there traditionally is some kind of a stressor or multiple stressors that provoke a physical reaction within the body. This is unconscious. It is not done purposefully. And it's almost like thinking that the stress wells up in your body and has to come out in some way, shape, or form.
Dr. Jennifer McVie could not explain why the disorder typically affects women or why it would happen in a group. Farrah doesn't believe stress triggered her condition, and her mother worries whether time is on their side.
She does not have time for I feel or guesswork or anything like that. She's deteriorating.
I don't think this is in my head. I don't think I can wake up from a nap and this just happened.
Until doctors can do something, Farrah says she hopes one day she'll just wake up and be herself again. Jason Carroll, CNN, Leroy, New York.
And there were about 14 girls who experienced these tics, and I believe most of them, except for about 2, have recovered from it, and they have never found out exactly what has caused it. The second somatoform disorder is hypochondriasis, and this is one has a strong unjustified fear of coming down with a specific illness, such as cancer, heart disease, or AIDS. In somatization disorder, people make dramatic and vague reports of a multitude of physical problems rather than any specific illness. In somatoform pain disorder, it consists of complaints of severe, often constant pain with no physical cause. In body dysmorphic disorder, the person is intensely distressed about an imagined abnormality of the skin, hair, face, or other bodily area.
And going to extreme lengths to look like Barbie. Grown women drastically changing their looks to resemble the iconic doll. Images of a young woman have a lot of people crying foul today. The 21-year-old from Russia claims she is a real-life Barbie, as in the doll. But it's not just makeup. Some believe she has undergone extensive plastic surgery, all in an effort to look like one of the most famous and perhaps controversial plastic toys. Eyewitness News reporter Kimberly Richardson is here to show us this very strange obsession. Kim.
It is strange. Barbie was born on March 9th, 1959, and was an instant hit. In fact, Mattel claims it sells 3 Barbie dolls every second. But some women seem to have a strange fixation with her that goes way beyond child's play.
I just kind of like the natural process of, life, living, and aging.
After all, beauty is in the eye of the beholder. But imagine if Barbie magically morphed into a human being. Experts say she'd be 5'9", 110 pounds, and be so out of proportion, would be a 38 double D, she'd have to walk on all fours. Seems far-fetched. Not to this 21-year-old Russian woman who claims to have transformed into a real-life Barbie. She's not the only one. This Barbie wannabe says she had a nose job, lip injections, and dyed her hair, all to look like the doll who many little girls consider a best friend.
Everybody ends up feeling inadequate in some way or another.
Dr. Alan Ravitz says going to such extremes breeds dissatisfaction with body image.
Well, it ends up building low self-esteem. It ends up building this kind of idea that no matter how good you are, you're never good enough. Nobody has an 18-inch waist, except for people with anorexia nervosa.
But this obsession to be like Barbie,
this tutorial is going to show you how to look like
it's even here. This YouTube video has gotten nearly 25 million hits. Doctor, if a patient were to come in and said, I want to look like Barbie, would you do it?
I would say no.
Because among other things, the doctor says looking like this is not compatible with life. It would be difficult to have normal body functions. And he points out the patient, regardless of what the plastic surgeon did, would never be good enough.
Body dysmorphic disorder is a situation where somebody thinks about themselves in such a low esteem that in many ways you can't ever satisfy their goals.
Now, experts say one of the most troubling things with all of this is that these women are using such a rigid set of criteria to define beauty, adding plastic surgery is meant to enhance the body, not transform it. Liz and David.
Very good point. And I like that. I want to re-emphasize the point that Barbie, real Barbie, would be on all fours.
Like a puppy.
Like a puppy.
Yes. Yes.
Thank you,
Yes.
Kimberly.
Okay.
A number of biological, psychological, and social factors have been suggested as contributing to somatoform disorders. Somatoform disorders may be learned ways of gaining attention and can produce benefits by relieving sufferers of unpleasant responsibilities. Some may be triggered by severe stressors. Others may be a result of focusing on threat-confirming information or of oversensitivity to physical sensations. Abnormal serotonin functioning has also been associated with hypochondriasis, and various combinations of neurochemical and social skill deficits appear to accompany conversion disorder and body dysmorphic disorder. Some cultures may encourage channeling psychological conflicts into physical symptoms. And that is it for Section 2. Section 3 will look at dissociative disorders and affective disorders.